Imagine, going to the doctor because your eyes are just constantly burning. They feel gritty. They're pouring with tears. You explain all this frustration, the stinging, the blurry vision.
And you're basically just told to stop looking at your phone so much.
Right, exactly. Or they tell you to go buy some basic allergy drops at the pharmacy. But, I mean, what if the actual culprit isn't your screen time at all?
Yeah, trying to fix this kind of dry eye with standard over-the-counter drops is, well, it's kind of like trying to fix a basement flood by replacing your roof shingles. You are looking in completely the wrong place.
It makes no sense. And welcome, fellow curious learner, to your custom-tailored deep dive. Today, we are tackling a question that is, honestly, incredibly frustrating. It's surprisingly common, but rarely talked about openly, which is, why do your eyes feel constantly dry, gritty, and irritated during menopause?
It really is a classic case of mistaken identity in medicine. Because, the symptoms are happening in the eye, obviously, but the root of the problem is actually completely systemic.
And to really get to the bottom of this for you, we are pulling from a pretty robust stack of sources today. We've got clinical guidelines from the British Menopause Society, detailed research guides from the Eye Clinic London, patient insights from Menopause Care, and a bunch of overlapping ophthalmic and dermatological studies.
Which is great because it gives us a really holistic view.
Exactly. So the mission for this deep dive is to just completely demystify this symptom. We're going to explore the surprisingly complex anatomy of a tear, look at exactly how shifting hormones hijack your eye health, and most importantly, walk through some practical science-backed strategies to finally get you some relief.
Because the relief is out there. It really is.
Right. So let's jump right into the sheer scale of this problem because, I feel like I hear about hot flashes and brain fog all the time, but dry eyes, it almost feels like a secret symptom.
It does, but the statistics are actually staggering when you look at the clinical data. According to the research, approximately 61 to 62% of perimenopausal and menopausal women experience dry eye syndrome.
Wait, over 60%. That is a massive majority of women going through this transition.
It is huge.
Yeah.
And yet, there is this massive disconnect in public awareness. A survey from Eye Health UK found that a whopping 86% of menopausal women did not realize there was any connection whatsoever between their eye discomfort and their changing hormones.
86%. That's maddening to think about. You're sitting in a freezing air-conditioned office, staring at a spreadsheet, and your eyes just feel like sandpaper.
And because you don't know it's your hormones pulling the strings, you just blame yourself.
Exactly. You're thinking, oh, I must be staring at my computer too much, or, I guess I just have bad eyes now that I'm getting older.
Yeah, and the patient narratives from menopause care highlight exactly that kind of internal gaslighting. Women literally spend years bouncing between optometrists and general practitioners.
Just looking for answers.
Right. And the symptoms themselves, they are bizarre and highly disruptive. It's rarely just a simple feeling of dryness.
So what does it actually feel like?
Well, patients describe this persistent, gritty or sandy sensation. Like they feel like there is literally a piece of dirt stuck under their eyelid that they just cannot wash out.
Oh, that is the worst feeling.
It is. Plus, there's burning, stinging, intense light sensitivity, and even blurred vision that magically, but, only temporarily clears up when they blink.
Okay, so let's unpack this for a second because there's one symptom mentioned in the sources that completely threw me. The watery, dry eye.
Oh, the paradox. Yeah.
Right. How on earth can your eyes be excessively tearing and watering if the fundamental medical problem is that they are dry? It makes no sense.
It's totally counterintuitive. But what's fascinating here is that the watering is actually a physiological distress signal. In the clinic, we call it reflex tearing.
Reflex tearing, right?
So when the surface of the eye becomes overly dry and irritated, the local nervous system essentially panics. It sends this emergency signal to the lacrimal gland to just flood the eye with tears. It's desperately trying to wash away whatever it thinks is causing the irritation.
Ah, okay, I see. It sounds like running your windshield wipers on a windshield covered in sand, but without the right washer fluid.
That is exactly it.
Like, the wipers are going frantically, dumping water everywhere, but the friction just makes the irritation worse.
Precisely. The eye is dumping out water, but water alone isn't enough to fix the problem. The washer fluid in this scenario is fundamentally broken. It lacks the necessary structural components to actually soothe and protect the eye.
So if the washer fluid is broken, what exactly is supposed to be in it? Because I think most of us, we just assume a tear is basically salt water.
Oh, not at all. A healthy tear is an absolute engineering marvel. It's a microscopic, three-layered biological shield.
3 layers. Wow.
So if we break down that anatomy, starting closest to the eye itself, we have the mucin layer. This is the inner layer produced by conjunctival goblet cells.
Mm,
You can basically think of it as the glue.
the glue. Okay.
Right. It's a sticky mucus layer, and its sole job is to adhere the rest of the tear film to the slick, curved surface of the eyeball.
Because, without that glue, the water would just beat up and roll right off the eye, right? Like rain on a newly waxed car.
That is exactly how it works. So sitting directly on top of that mucin glue is the middle layer, the aqueous layer.
And this is the watery part?
Yes. This is produced by the lacrimal glands, which are tucked just under the outer part of your brow bone. It's the thickest part of the tear. It provides hydration, essential salts, and vital nutrients to the cornea.
Because the cornea doesn't have its own blood supply, right?
Exactly. It relies entirely on tears for nourishment.
Okay, so we have the glue, we have the water, and finally the outer layer, which, looking at the research, seems to be the main culprit in our whole story today.
The lipid layer. This is the microscopic outer oil layer, and it's produced by these things called the meibomian glands.
Meibomian glands, got it.
Right. You have dozens of these tiny vertical tube-like glands lining the edges of your upper and lower eyelids. And every single time you blink, the mechanical action squeezes these glands, and they secrete a tiny amount of specialized oil.
So the blinking is actually pumping the oil out.
Exactly. And this oil layer acts as a seal. It coats the watery layer underneath and completely prevents it from evaporating into the surrounding air.
So we have this delicate little sandwich going on, glue on the bottom, water in the middle, and an oil seal on top. Where does menopause come in and just completely disrupt this?
Well, if we connect this to the bigger picture, all of the glands we just mentioned, the goblet cells, the lacrimal glands, and especially those meibomian oil glands, they all have specific receptors for sex steroid hormones.
Okay.
They're constantly listening to your endocrine system. As estrogen and progesterone fluctuate erratically and eventually decline during perimenopause and menopause, the aqueous watery layer absolutely suffers. But the clinical research points to androgens as the primary critical regulators of those meibomian oil glands.
Wait, hold on. Androgens? Aren't androgens typically considered male hormones, like the testosterone?
Yes, that is.
Why are they so critical for a woman's eyes?
It is a massive misconception that androgens are strictly male hormones. Testosterone is absolutely vital for women's physiological function.
Really?
Oh, yeah. In fact, testosterone is the most abundant, biologically active sex hormone in a woman's body throughout her entire reproductive years.
That is wild. I had no idea.
Most people don't. It peaks in your 20s and then it just steadily declines. By the time a woman reaches her mid-40s and enters perimenopause, her testosterone levels have dropped by about 50%.
Wow. So, we always talk about the estrogen cliff, but we are completely ignoring the fact that testosterone is also just plummeting.
Exactly. And those meibomian glands in your eyelids are highly, highly dependent on those androgens to function properly.
So what do the androgens actually do for the glands?
Well, androgens stimulate the glands to synthesize lipids, the oil itself. And they also play a crucial role in preventing the glands from keratinizing.
Keratinizing. What does that mean in this context?
Imagine the tiny exit pipe of the oil gland getting clogged up with hardened, dead skin cells. That process is keratinization.
Ooh, yuck. Okay.
Right, so androgens normally keep those pipes clear, but as androgen levels drop significantly during the menopausal transition, these meibomian glands begin to literally atrophy.
They shrink.
They shrink, they get blocked with dead cells, they produce significantly less oil. And unfortunately, the tiny amount of oil they do manage to produce is often thick, opaque, and very poor quality.
Oh, wow.
Yeah, it becomes more like toothpaste than olive oil.
That sounds awful. So without the androgens, the oil factory basically just shuts down and boards up its windows. And without that outer oil layer, the watery part of the tear is just totally exposed to the open air.
Exactly. And this direct consequence, the lack of a functional oil seal, causes a complete structural collapse of the tear film.
And what's the clinical term for that?
In the medical literature, this is known as meibomian gland dysfunction, or MGD. It is the leading cause of evaporative dry eye disease, and it literally launches the ocular surface into a devastating, vicious cycle.
So here's where it gets really interesting to me, because the sources described this cycle, and it immediately reminds me of boiling a pot of water.
Oh, that's a good analogy.
Right. Like, if you leave a pot of water simmering on the stove, but you don't put a lid on it, the lid being the oil layer, the water just vanishes into thin air. And eventually, the water is completely gone and the pot itself starts to burn. Is that essentially what's happening to the eye?
That is a perfect way to visualize it. Because the tears evaporate so rapidly without that protective lipid layer, what gets left behind on the surface of the eye is a highly concentrated salty residue.
The salt gets left behind.
Exactly. The water leaves, but the salt stays. In medical terms, this state is called hyperosmolarity.
And I mean, pouring salt on an already dry, sensitive eye, that sounds like torture.
It is incredibly painful. This high salt concentration is literally toxic to the delicate surface of the eye. It acts as a major irritant and triggers an intense, localized inflammatory response.
So the immune system rushes in.
Right. It rushes in, causing inflammation. But here is the truly vicious part of the cycle.
Yeah.
That inflammation directly damages the very cells that are trying to produce the tears in the first place.
Oh, no.
Yeah. That damage leads to an even more unstable tear film, which leads to faster evaporation, which creates more concentrated salt, which triggers more inflammation.
The eye is literally burning from exposure and its own immune response. That's terrifying. And, it's not just the internal hormone drop doing this, right? The sources make it really clear that our modern lifestyles are essentially pouring gasoline on this fire.
Absolutely. We have this internal systemic hormonal withdrawal, but then we stack severe external accelerants right on top of it. First off, just basic aging means our overall basal tear production naturally drops.
Right, just getting older.
Then think about the environments we live and work in. We stare at digital screens all day long. When you look closely at a computer monitor or you're just scrolling on a phone, your blink rate unconsciously drops by more than half.
And if you aren't blinking, you aren't squeezing the eyelids, which means, based on what we said earlier, you aren't expressing that vital, thick oil from the glands.
Exactly. You're starving the eye of what little oil it has left. Add to that the low humidity environments we constantly inhabit, like air-conditioned offices, airplanes, or, central heating in the winter.
It's just a recipe for disaster.
It is. Then factor in things like wearing contact lenses, which physically disrupt the tear film. Finally, consider the common medications so many people take daily.
Like what kind of medications?
Over-the-counter antihistamines for allergies, certain SSRI antidepressants, blood pressure medications, diuretics. All of these have systemic drying effects on the body's mucous membranes.
Wow.
Yeah, so the ocular surface really doesn't stand a chance when you combine the hormonal collapse of menopause with all these modern environmental stressors.
Okay, so logically speaking, if the root cause of this vicious evaporative cycle is a systemic lack of hormones, logic would dictate that hormone replacement therapy, or HRT, should just be the magical fix. Like, you use an estrogen patch or a gel, your hormone levels go back up, and your eyes get better.
You would certainly think so.
But reading through the clinical data provided in the sources, it is so much more complicated than a simple equation.
It really is. This raises such an important question, and it's honestly one of the most fascinating and frustrating paradoxes in menopause care. The jury is definitely still out on HRT and dry eyes, and the clinical evidence is highly conflicting.
Conflicting how?
Well, some women absolutely do find relief with HRT because it can help smooth out the extreme, erratic hormonal fluctuations of perimenopause. That provides some stability to the aqueous tear production.
Okay, but there's a pretty massive however coming, isn't there?
A very significant one. If we look at massive longitudinal data pools like the Women's Health Study, which, remember, followed tens of thousands of women over years, they found something entirely counterintuitive.
What did they find?
Women using estrogen-only postmenopausal hormone therapy actually had a 69% increased risk of dry eye disease compared to women who used no hormone therapy at all.
A 69% increased risk. I mean, why on earth would replacing a missing hormone make the dryness significantly worse?
It comes right back to the specific microscopic anatomy we just discussed. Remember, those meibomian oil glands are primarily driven by androgens, like testosterone.
Right, the testosterone.
Exactly. Standard HRT regimens are typically focused exclusively on replacing estrogen and progesterone. Pumping the body full of estrogen alone does absolutely nothing to fix the underlying androgen deficiency that is starving the oil glands.
So you're fixing one hormone, but you are completely ignoring the one the eyelid actually needs to make the oil seal.
It's actually worse than just ignoring it.
Really?
Yeah. Estrogen can sometimes have what's called an anti-sebaceous effect.
Anti-sebaceous, meaning anti-oil.
Yes. In certain tissues, estrogen actively competes with androgens for receptors. and it can act to suppress lipid synthesis. It literally dials down oil production.
Oh, wow. So it's actively working against the oil glands.
Right, so by adding systemic estrogen without balancing the androgens, you might inadvertently be shutting down the oil factories even further, destabilizing that delicate tear film.
That is wild.
It is. It's a perfect example of why treating a broad systemic issue with a blanket hormone approach doesn't always magically resolve a localized specific glandular problem. The eyes often need a highly targeted approach.
Okay, so what does this all mean for you, the listener? You're dealing with the gritty, burning pain, and we've just established that standard HRT isn't necessarily a guaranteed silver bullet for the eyes.
Mhm.
How do we break this vicious cycle of evaporation and inflammation? How do we actually put the fire out?
The good news here is that there are incredibly effective targeted strategies. But you really have to take proactive control of the microenvironment of the eye itself. It starts with daily habits and dedicated at-home care.
It sounds to me like you need a daily skincare routine, but like specifically for your eyeballs.
That is the absolute perfect way to frame it. Just as you might, meticulously moisturize, apply serums, and exfoliate your face to combat aging, your eyelids need dedicated daily maintenance.
So what does this routine look like?
The foundation of this is a clinical three-step eyelid hygiene routine: heat, massage, and clean.
Let's really break those down so the listener knows exactly what to do. Step one is heat. And I'm assuming a quick splash of warm water in the morning shower isn't really going to cut it.
No, not at all. Because the oil in those meibomian glands have become thick and stagnant. Remember, it's more like toothpaste now. You need sustained heat to melt it back into a liquid state.
Okay, so how do you get sustained heat safely on your eye?
Applying a warm compress is key. Ideally, you want a specifically designed microwavable or USB heated eye mask. And you have to leave it on for a full 10 minutes. It has to be 10 minutes to reach the therapeutic temperature needed to liquefy that blocked meibum.
Okay, so you sit there for 10 minutes, the oil is finely melted, but you can't just take the mask off and go about your day, right? Because the oil is still stuck inside the gland.
Exactly. Which brings us to step 2, massage. While the oil is still warm and melted, you have to physically express it.
How do you do that?
You gently massage the eyelids with your fingertips, rolling from the base of the lid toward the lash line, or you do a series of very forceful, conscious, hard blinks. This mechanical pressure acts like squeezing a tube of toothpaste. It pushes the melted oil out of the glands and onto the surface of the eye.
Okay, but so now you've just squeezed all this stagnant, previously trapped oil along with whatever dead skin cells were clogging the pipe right onto your lash line. You definitely can't just leave that sitting there.
No, you can't. And that is step 3, clean. You need to use specialized, gentle eyelid wipes or a dedicated lid foaming cleanser to carefully clear away any of that expressed debris, bacteria, or excess crusts from the lash line. Because if you don't clean it away, the glands will simply get blocked up all over again, or the bacteria will feed on the debris and cause more inflammation.
It really is a deep exfoliation and moisturizing routine. That's fascinating. Now, what about from the inside out? The sources mentioned diet actually playing a role in tear quality.
Yeah, systemic hydration is obviously key, but the research specifically points to significantly increasing omega-3 fatty acids in your diet.
So like eating more fish.
Exactly. Whether that's through eating more oily fish like salmon and mackerel or taking high-quality supplements, omega-3s work double duty. They help reduce systemic inflammation throughout the entire body, and they provide the building blocks to support the actual quality of the lipid layer your meibomian glands produce.
That makes a lot of sense.
There's also evidence that potassium-rich foods, like bananas and sweet potatoes, help maintain the cellular health of the tear film.
And we absolutely cannot forget the environmental side of things. Earlier, we talked about staring at screens and not blinking. The sources recommend this thing called the 20-20-20 rule.
Oh, yes. Highly recommended.
So basically, every 20 minutes of screen time, you look at something 20 feet away for 20 seconds. It forces you to break that hypnotic digital stare, refocus your eyes, and actually, blink fully.
It's such a simple habit, but it's incredibly effective at keeping the oil flowing. However, we really must acknowledge that sometimes at-home care just isn't enough.
Right.
When the structural damage to the glands has progressed too far or the inflammatory cycle is just too severe, you need to step up to medical interventions.
Right. Moving past the warm washcloth and the omega supplements, what are the actual clinical options available when you go see a specialist?
Well, the absolute first line is usually artificial tears, but there's a crucial caveat here. You must ensure they are preservative-free.
Why is that so important?
The chemical preservatives used in many standard bottled eye drops can actually act like a harsh detergent.
Oh, no.
Yeah, if you are using them frequently on an eye that is already severely inflamed and lacking its protective lipid layer, those preservatives will just cause more toxicity and damage. So you're just making it worse.
Exactly. For nighttime, there are thicker, preservative-free gel drops or ointments that provide a heavier shield while you sleep. And if the mucin layer, that glue layer, is overproducing, doctors can prescribe mucolytic drops.
Mucolytic. Let's decode that word. What exactly are those drops doing?
Think of mucolytic drops as chemical scissors.
Chemical scissors, okay.
When the eye is super dry, sometimes the goblet cells panic and produce way too much sticky mucin. This results in thick, stringy mucus strands in the eye. These drops literally chop up and dissolve those thick strands to clear your vision.
That makes perfect sense. But I mean, what if over-the-counter drops, even the fancy preservative-free ones, just aren't cutting it against that burning inflammation? Like, it's really bad.
Then an eye care specialist might move to prescription anti-inflammatory drops. We're talking about medications like cyclosporine, which is sometimes prescribed under brand names like Icurvis or Restasis, or another medication called Lifitgrast.
And how do those work? Are they just, like, stronger wet drops?
It's not at all. No. Cyclosporine essentially acts as a localized mute button for your immune system.
A mute button.
Exactly. It targets the T cells on the surface of the eye and tells the white blood cells that are actively attacking your tear glands to just stand down. By physically stopping the localized immune response, it halts the inflammation, which finally gives your tear-producing cells a chance to heal and function again.
Wow, that's powerful. And I also saw something in the clinical notes about plugging the drains. That sounds intense. What is that?
Oh, they're called punctal plugs, and it's actually a very simple, elegant solution. You have tiny natural drainage holes in the inner corners of your eyelids called puncta.
Right.
This is where tears normally drain away into your nasal passages. A doctor can insert microscopic temporary silicone plugs right into these drains.
Oh, I get it. It's literally just putting a stopper in the sink.
That's exactly what it is. If your overall tear production is incredibly low, plugging the drain ensures that whatever precious moisture you do have, or whatever extensive artificial drops you apply, stays pooled on the surface of the eye for much longer, rather than immediately draining away into your nose.
That is brilliant. Just keep the water in the basin. And finally, there's a light therapy mentioned in the studies, IPL.
Yes. Intense pulse light.
Wait, flashing bright lights into an already sensitive, burning, light-sensitive eye. That sounds like medieval torture, to be honest. How does that not make the inflammation infinitely worse?
It does sound counterintuitive, but intense pulse light, or IPL therapy, is proving to be a revolutionary treatment. It's a highly targeted dermatological treatment where controlled, gentle flashes of broad-spectrum light are applied to the skin around the eyes and the cheekbones.
So not directly into the eye?
No, around it. The light energy converts to heat, which deeply melts that stubborn, thick oil trapped in the meibomian glands.
Oh, so it's like a supercharged version of the heated eye mask we talked about?
It is, but it goes much further than just heat. The specific wavelengths of light used in IPL also have a direct anti-inflammatory effect on the tissues.
Really?
Yes, and more importantly, it actually destroys abnormal, leaky blood vessels called telangiectasia that often grow around the eyelids in response to chronic inflammation.
Leaky blood vessels.
Yeah, these leaky vessels dump inflammatory markers right next to the tear glands. So by closing them off, IPL cuts off the supply chain of inflammation. It is an excellent advanced option for women suffering from really stubborn, menopause-induced dry eye disease.
Wow. We have covered a massive amount of ground today. Let's synthesize the journey we've just been on because, dry eyes during perimenopause and menopause are not just an inevitable, dismissible annoyance of getting older.
They absolutely aren't.
And they aren't just from looking at your phone. They are a direct structural result of falling hormones, specifically the often ignored androgens starving your tear film's oil glands. This starvation triggers a cascading cycle: rapid tear evaporation, concentrated salt toxicity, and a burning inflammatory immune response.
Right. And we learned that while systemic hormone replacement therapy is wonderful for many, many symptoms, it isn't necessarily a guaranteed targeted fix for the eyes. In some cases, unopposed estrogen can actually suppress oil production further.
But the major empowering takeaway here for you, the listener, is that your discomfort is entirely valid. It is a real, measurable physiological change, and most importantly, it is highly treatable. You do not have to just grit your teeth and accept burning sandpaper eyes as your new normal.
Absolutely not.
with targeted eyelid hygiene, committing to that daily eyeball skincare routine of heat, massage, and cleaning along with the right medical interventions from an eye care specialist, you can absolutely break the evaporative cycle.
It just requires a dedicated, multi-layered approach, really mirroring the complexity of the tear film itself.
Exactly. So to close this deep dive out, what is the final lingering thought we want to leave the listener with today?
Well, we've seen today how deeply and unexpectedly interconnected your entire endocrine system is, with something as small and seemingly insignificant as the tiny oil glands lining your eyelids.
Yeah.
It really makes you pause and wonder. If your eyes have specific hormone receptors that can alter your tear composition so drastically, causing such immense discomfort, what other seemingly unrelated microfunctions in your body are quietly listening to the hormonal shifts of menopause? What other frustrating symptoms are out there waiting to be understood and systemically supported, rather than just being dismissed or treated topically?
That completely changes how you look at the human body. I mean, we started this deep dive talking about the frustration of misdiagnosis, like trying to fix a flood by repairing the roof. Menopause touches everything. It is a fundamental shift in the operating system of the entire body. But just because the connection isn't immediately obvious to every doctor doesn't mean the pain isn't real, and doesn't mean there aren't highly effective answers waiting to be found.
We just have to know where and how to look.
Beautifully said. Until next time, keep asking questions and keep diving deep.